Good morning from here in Washington, D.C. On this rainy day in Washington, you're getting a look at my home office. I'm Raj Kumar. I'm the president and editor-in-chief of Devex. And if you're a regular at Devex Newsmaker events, you're used to joining this online, but you might not be used to seeing all the participants joining from their various locations around the world. That's what we're doing today. And we're delighted to be with you during these unprecedented times for a really relevant discussion, a discussion I think made more relevant by the dramatic pandemic that's sweeping the world today. We're here to talk about a different infectious disease, tuberculosis, and we're doing that on the eve of World TB Day, which is tomorrow. And I know we have participants from all over the world, people who work on this issue, people who work in global health more broadly, or others from the Devex community who are interested in what is the world's largest infectious disease killer. Not often talked about. It's not something, unlike the coronavirus today, which affects every country around the world and everyone has started to pay attention to. It still remains a disease that's largely in the shadows, that affects the most vulnerable people among us on this earth. But it is the largest infectious disease killer. And it's been with us since the very beginning of humanity. And yet, even though there hasn't been very much progress on this in the last 40 years or so, we are now living in a unique moment. There has been tremendous innovation, tremendous energy and excitement around what is possible. And that's one of the reasons we wanted to bring this Newsmaker event together, that the timing of it just happens to be really well aligned with the reality that the world is now thinking in different ways about the importance of infectious disease control, of health systems, and we're going to have a rich discussion about that today. Again, this is a Newsmaker event, and we think it generates news in the sense that TB is so relevant. And I think you're going to learn a lot about the current state of affairs on tuberculosis, one of the world's most important global health issues today. So we are joined, as always, by a Devex journalist who's going to be leading this event. We have incredible participants, the head of the Stop TB Partnership and the chief of TB from the CDC. People are joining us, both presenters on this call and those of you who are joining from around the world during a very unprecedented time for our community. As you know, Devex serves a community of over 1 million global health and global development professionals. Many of them are working in very challenging circumstances right now, trying to respond to the novel coronavirus. Many others have seen their work and home life very much disrupted as they're trying to find ways to be effective on a number of issues at a moment of a global pandemic. So we thank you for making the time to be with us today. Those who are joining us live will be watching this later in the recorded version. Thank you for being a part of this. And I also want to say a big thank you to our partner, US Pharmacopeia. These Newsmaker events cannot happen without support from partners, and we're delighted to have a long-standing partnership with USP. I think those of you who are working in global health regularly do know USP, but not everyone who I talk to in the development sector does. And often I think that's because USP works a little bit in the background and to make sure that the quality of our health systems, of our medicines, of our delivery systems are high. And that quality issue is not always a front page story, but it certainly is now as we think about the importance of health systems, as health systems are becoming a global front page news story. So I want to ask Ron Piervincenzi, who is the CEO of US Pharmacopeia, to get us started with some introductory remarks before we move on to our discussion. Ron, I pass it to you.
Thank you, Raj. I appreciate that. So the reality is that the systems we rely on for treatments in tuberculosis are, of course, by definition, the same. They are the same systems that we have to rely on for all of our medications, and certainly including those that we're looking to fight the coronavirus. USP's founding was actually in 1820, and so Raj is right. We're actually celebrating our 200th anniversary this year. I think rather than celebrate in a traditional sense, we are really looking back in history and looking at where other crises have occurred and thinking, how do we bring those same learnings and mindsets to bear today, but with modern technology. Our founding was by 11 physicians who were concerned about the medicine supply, quality, and medicine reaching patients. What we have right now and what we see with regards to tuberculosis in the past, what we see with coronavirus today and the treatments for COVID is vulnerabilities in the broader medicine supply chain. There are vulnerabilities that play out whether the medicines be donor funded, whether those same medications are being procured locally at the country level or even at a health system and patient level. And those vulnerabilities have to do with the lack of inability to pay, lack of transparency, and where the sources and medicines are coming from. And on top of that, then you add in disruption. And disruptions can come in many forms. We have disruptions with viral outbreaks, including Ebola, SARS, and MERS. And of course, now it's been quite unprecedented. One of the challenges, though, is that it is not only a disruption that affects the patient in a particular area. So, for example, for coronavirus, but then it ripples around the world as the supply chain relies on so many others. A very big concern we have is for lower and middle income countries who have even less of their own manufacturing supply, have a smaller role in the supply chain, and maybe even more vulnerable to disruptions. And so we think about the importance of keeping medicine supplies, and tuberculosis might be the best example in the world, where we're taking a shift from a lot of donor-funded medications to locally procured. And that local procurement now needs to rely on its own mechanisms for regulatory assurance, for market surveillance, to make sure that those medicines are of a high quality. Because disruptions from a macro standpoint, what we see from coronavirus, or from a smaller standpoint, what we see locally, result in substandard and counterfeit medicines. The sad truth is that there are as many people looking to take advantage of these discontinuities to hurt people and to make an illegal buck. That's our reality. And so what we can do to fight that is to have resilience in the system and also a bit more diversity around the world. So at USP, we're really proud to have been working now for 200 years in this space, and the last 25 or so dedicated more in the development space, helping build regulatory systems around the world. Our partnership with Stop TB, which is not new, but is even ramping up further as we speak. We're really proud of that work. One of our signature projects we do in collaboration as a cooperative with USAID has been renewed as a new program called PQM, Promoting the Quality of Medicines, and now PQM Plus. That's gone on over 27 years of continuous collaboration that we're really, really proud of. So again, thank you back to Devex and Raj for hosting this important event, and I look forward to joining as a participant to view the rest. Thank you.
Thank you, Ron, and thank you to USP for what you do every day and for supporting this and the whole series of newsmakers and other events we've been doing around the world on the importance of health systems. Again, health systems is something, if you're a regular reader of Devex, if you attend and view our events, you know we've been on this topic for a long, long time, but it has often been hard. It's been hard to push that storyline, and I think we're in a different moment now, certainly. So thank you for taking some time to join us today and be a part of this. I do want to just say on a personal note, thank you to the Devex team all around the world working hard to make this event happen and events like this to keep our coverage going. And thank you to our members, 1 million strong around the world, who are supporting Devex through this as we try to bring you the news that you need to do your work on all of the critical issues, including on the response to the novel coronavirus. Thank you for that. Let me pass it over to Adva Saldinger, who are regular readers, Devex, who watch our events. Adva is a senior reporter here. She is an expert on the development finance, infrastructure, and ecosystem. She covers a wide range of topics, including global health, and is going to be helping us to moderate what I think will be a really dynamic discussion today. She'll talk to you about how we're going to solicit questions from all of you, but we do want your engagement both as part of this conversation and following up online. So thank you again, and over to you.
And welcome, everyone. We're really happy you could join us. And as Raj said, before we get started, I did want to go over a few housekeeping details. If you have any technical issues hearing us or seeing us, please send a message using the Q&A chat box, which should be on the right-hand side of your screen. One of my colleagues on tech support will help you out. And we'd also love to get your questions. This is meant to be sort of an interactive discussion, as interactive as we can make it. So if you have questions, please submit them in that same Q&A box at any point during our discussion. And at the end of our discussion during the Q&A portion, we'll get to as many of those questions as we can. So with that, I want to dive right in, and I want to introduce our guests for today, Dr. Lucica Ditiu, who is the Executive Director of the Stop TB Partnership, and Dr. Susan Maloney, who is the Chief of Tuberculosis at the U.S. Centers for Disease Control. So thank you both so much for joining us today. The first question I wanted to ask you both is sort of a scene setter to give us a sense of where we are today in the fight against TB. I know that under the NTB strategy, 2020 is a really important year. This is the year where the world should achieve a 35% reduction in TB deaths, a 20% reduction in TB incidence rates, and there was a goal also for TB patients and their households no longer to face catastrophic costs as a result of TB. So where do we stand on hitting those targets? Can you help us paint the picture of where things stand today in the effort against TB? Lucica, do you want to start us off?
Okay, yeah, that's what, thank you so much. So I want to use 10 seconds to really thank you guys in Devex, but also everyone else that is looking at us or plan to do so, because it's an important moment and we don't have very many occasions, and it's spectacular that this takes place given the conditions in which we all are. So thank you very much for giving this opportunity. So we have the 2030 targets and the fact that we have tuberculosis as a, one of the SDG targets. So we are all aiming to end the TB by 2030. And as you rightly said, this year is extremely important. It's very important for the 2030 and 2020 targets parts of the NTB strategy, but it's also very important as part of the UN high-level meeting targets. And as we all know, in 2018, we had this UN high-level meeting that was in September, in which heads of states and governments committed to very significant targets, to very significant achievements to be done. 2020 is basically a very important year because at the end we will have a UN Secretary General report on the progress done between 2018 and now. So in terms of, so we have the 2020 targets part of the NTB strategy and we have the UNHLM one. They are all fully aligned. In terms of where we are, I think there is some good progress in terms of the catastrophic costs in some parts of Asia, and progress and work is happening now, led by the colleagues in WHO in trying to measure these catastrophic costs and where we stay with it. And before this entire situation started, actually, the targets in terms of enrolling people on treatment, people with TB, but also people with MDR-TB were as well, I would not say that almost ready to be reached, but we are making some great progress in terms of sensitive TB. We are on track to achieve a close of the gap in terms of people that are missed with tuberculosis by the end of 2022. The lagging behind component, which impacts obviously the decrease in incidence and mortality, is related to the MDR-TB, in which the difference between the very broad end TB strategy targets, which are expressed in percentages and so on, is that for the UNHLM, we speak of real people. So by the end of 2022, we should have around 1.5 million people with MDR-TB on treatment, and we are not even close to do that. And we are far behind in terms of the preventive treatment and so on. So there are some parts that are advancing, I would say. There is still a lot of work to do, and the current environment is actually creating additional challenges for us.
And Susan, what are your thoughts?
Yeah, thanks, Lucica and everyone. I agree with everything that Lucica said, and want to echo again that we are working very hard. The UN high-level meeting especially brought all the global partners together to really focus down and to move towards these targets. And although we are, still trying to close some of these gaps, I think one thing I want to highlight is the US CDC is a partner of PEPFAR, and PEPFAR has committed to putting close to 2 million all people on HIV treatment, on TB preventive treatment by 2022. And this has really led to an enormous scale up of TPT among people living with HIV. If you think about it, in 2017, fewer than 1 million people living with HIV were receiving TPT globally. And during 2019, 1 year alone, PEPFAR put close to 2 million people living with HIV on TPT, and we've set out to put an additional 7 or 8 million people on TPT in the next 2 years. And this should put the world on the trajectory to reach or exceed the UN high-level meeting of putting 6 million people on TPT by 2022. So there's positive things. We are not, as Lucica said, as on track, especially around TPT for adult contacts and for children. But we're really working to overcome those barriers and building partnerships and coalitions. One thing CDC has done recently is collaborate with the International Union Against TB and Lung Disease to launch a Sub-Saharan Regional Child and Adolescent TB Center of Excellence, which is a virtual network of TB professionals and ministries of health to help countries procure child-friendly TB medications and scale up TPT among children. And we're also working to scale up TPT among adults and children under 5 using lessons from PEPFAR and from U.S. TB elimination efforts. So I would say that the big thing that we need to do moving towards these targets is developing new diagnostic tools. I think we're moving down that pathway, having shorter and more effective treatment regimens for all types of TB, and especially MDR-TB, as Lucica has noted, and having an effective vaccine that can really be brought to scale.
Great, and we'll get to that question on the types of treatments and where we stand in the search for a vaccine in just a minute. But I did want to sort of get pretty quickly to the elephant in the room. We're obviously in the midst of the COVID-19 pandemic, and it's a really challenging, unique time. And it's an issue that's at the top of everyone's minds. And so I wanted to hear from both of you how this is affecting TB programs worldwide, how you think it's going to affect the achievement of some of these goals, and what it's going to mean for the fight to find better treatments for TB.
Hi, so thank you so much for this, because indeed, you're very right. As much as we are all extremely passionate and engaged in the fight to TB, to end TB, reality is that the world is in a status now that if somebody would have told us in January that there will be almost no flights in this world happening for weeks, and we will all be where we are at homes, and the situation that we are faced with, anyone in his normal head would have said that this is a fantasia, right? It will never happen. So we cannot ignore this. The points that I want to make, so basically over these days, I thought a lot about this, and I'm actually not, I'm actually unhappy for many reasons. Unhappy because I'll start with the points at the individual level. For people with TB, most of them, as we know, are also very often having their lungs affected. Most of them are coming from the men, are among men. They have other comorbidities associated. And also they are coming also from some of the vulnerable groups. The COVID-19 forms are more complicated than for the others. We already know that in the South Americas, the first ones to die are people that had, in some of the countries there, had TB and COVID. And I think this will be when we will stop we will be out of this and we will look at it, we will realize that this was a major impactful factor for the prognostic of how treatment of people with TB and MDR-TB will be. So I'm upset at this level because it will impact seriously as individuals. The people with TB will suffer much more from the COVID-19 forms. I am also worried very much, and it's not just a worry based on a feeling staying at home, but based on what we hear from the colleagues in the countries, that basically it's very difficult for people with TB to reach the services that are right for getting diagnosed. The symptoms of TB are pretty similar with the ones with COVID-19. It's a dry cough, fatigue and weakness, fever. So in some instances, because they cannot, if you have TB and you present the symptoms, if you are not considered a sort of suspect for COVID because you are not having the right contacts, you are not diagnosed, or you are sent home because, it's this moment when you have this triage happening, not to overburden the health system, but due to the isolation, then this sent home can have a big impact of the people that are living with you. So I think that at the individual level, there will be a significant impact there, which will be then translated into the fact that this year was supposed to be for us, as you rightly said, and Susan and so on, a year in which we were all committed to push to advance these targets, because last year we did pretty well in terms of scaling up as much as we can. So the fact that we have this situation now, it worries me, because I think the first 2 quarters of 2020 will be kind of lost for the acceleration of the targets, and it will have an impact. However, I think there are some things that we as the TB community have, and we should share in terms of fighting and learning the COVID community, to say so. That is basically also all of us, related to the same tools for diagnosis. Basically, for diagnosing COVID, you use X-ray. You use now. Recently Cepheid got approved their GeneXpert cartridge for COVID, using the same machine as the one for TB. So you can use that and be smart and test in the same time for COVID, but also for TB. And also in terms of ensuring the follow-up of the treatment, especially for the people that are vulnerable and we don't need to put them to move between the different facilities and their house. Using the adherence technology and some of the digital technology that we have in place, I think it will be extremely beneficial for the COVID community to do that. From Stop TB, we are putting together a lot of countries, and this is my last point because I know Susan will have several points to make as well. Several countries issued sort of guidance on how to deal with TB in the time of COVID-19. We are working with them. We are working as well with the colleagues from WHO, USAID, and the Global Fund and the other technical partners to issue some guidance at the countries, not guidance, but if it's practical advice. We are all in this situation where we are like, what next, how to handle it. And there are things that we should not forget in terms of the ensuring that the people with TB get diagnosed, get the treatment and the care in these difficult situations. And with all of this, I'm not sure that this will happen, but I'm sure we will have more points on this. Thank you.
Susan, please share your thoughts as well. And
yes.
I think I'm also curious about how we think resources might be redirected. I know we saw a question about that. So as we're looking at the impact of COVID-19, what could that mean for resources as well?
Yeah, so just to follow up with what Lucica said, I think if the lesson we're learning right now with COVID is that we need to unite and fight together and unite all the forces of all the stakeholders and partners to work towards treating people with COVID and people who have TB so that no one's left behind. I mean, I think, like Lucica said, we stand in solidarity and resilience in the fight for against the 2 airborne diseases, and we need to be looking for innovative and people-centered approaches to maximize the support that we can give to tackling both these diseases and looking at shared and leveraged platforms. I think Lucica already brought up Expert as one of the diagnostic platforms that can be used by both. I also think that TB has built a lot of capacity in countries that can be used to support the COVID response and continue the response to TB, both in terms of building laboratory capacity, surveillance capacity, expertise in contact tracing, and infection, and especially around infection control. I think we just need to be mindful that in public health, one of the most important things we do is to try to protect the most vulnerable populations, and both people infected with COVID 19 and TB fit the bill for that. So I think we need to also pay close attention to logistics and commodities and drug supply, as we've discussed before. It's very worrisome, I think, for the TB community to think of a disruption of the global drug supply right now. And the danger, we're already not meeting the targets around drug-resistant TB, and dangers around treatment interruption are just going to exacerbate that condition. And I guess I would say, lastly, is we all need to be very cognizant of kind of the heroes in our midst and the healthcare workers, and supporting them and sharing them for both these responses. We need to be creative. I think we can think about task shifting and the use of volunteers and phone and call-in services and WhatsApp and Zoom for our patients. As we're doing for ourselves, I think we need to do for our patients. And in terms of your question, Adva, about resources, I think as a community, we do need to be cognizant of kind of looking for fair share targets and support for TB to continue, especially along the research realm.
Great. I wanted to turn to this question about efforts at developing new therapeutics and a vaccine. We're obviously seeing this sort of rapid acceleration towards how to create therapeutics and vaccines and tests for COVID-19, and over the years, TB certainly hasn't seen that same sort of speed or momentum as we're seeing in this sort of moment of crisis for COVID-19. And so I would like to ask both of you, and maybe we'll start with you on this one, Susan. What does that vaccine and drug pipeline look like for TB right now? And why don't we yet have sort of those best tools for ending TB?
Yeah, thank you, Adva. Just as you have said, TB has really suffered from critical underfunding for years and years, and so that's part of why we aren't where we are. And as you also said, it's a very exciting time for TB right now because, we're having a lot of breakthrough moments, if you will, along a lot of different areas. In the prevention area, you brought up vaccine, and I think we are moving along and having the most types of vaccines in the pipeline that we could have. We have at least 2 promising vaccine candidates that we're hoping to move forward into trials. I think, again, one of the most challenging things about this is going to be sure to have the financing and support and kind of the global support and commitment to moving a vaccine like this forward. We've had major breakthroughs in diagnostics. We've had expert now for 10 years. Now we're moving to ultra and hopefully moving soon to a real point of care diagnostic. We have lots of molecular tests coming out. And now we need to look at operations research and how we decentralize expert and how we use these tools, these new tools, to the best of our abilities. I don't know if this is the time, but also to talk about another breakthrough in new drugs. We've had the first new drugs in the past 50 years for TB. We have shorter and less toxic regimens. We have new pediatric formulations. I'm a pediatrician, and this is an area that's very neglected, and I'm glad to see it moving forward. We have all oral MDR-TB regimens now, when we're having better outcomes with those. So overall, I think we're really moving in the ways of innovations, and I commend the global community as well for, in addition to kind of these breakthroughs and tools, there's been really rapid policy development and changes and adoptions of policies and putting them into practice over the past several years.
I can add to what Susan said 2-3 things. I'm very happy that you, Susan, laid out very well where we are in terms of the pipeline and all the developments that we have. I want to say, because you touched something on the commodities being available, the Global Drug Facility, our team from Stop TB, is doing a great job to push the things out there. So far, we don't have any shortage seen, but I am afraid we will. To say so, very interesting to see that we were all worried when China was in the lockdown, what happens with the Chinese manufacturers, especially the ones using the, for the products, all the ingredients that are produced over there. Now we see China is working and everything works fine, but we are monitoring very carefully what's happening in India. As you heard, there are many places in lockdown, including Mumbai, and we are monitoring very clear what's happening in Europe, because we will see, transit and operations and flights are very difficult. So it's a team that is continuously looking at this. I also have to say that we, as GDF, we procure protective equipment for laboratory, and there will be challenges with that as less and less of the, especially I have to say, Western European manufacturers are more like, it's mine, so I want to keep it in my country. So it's difficult to have that. Susan is right, we have now pediatric formulations, including for MDR-TB, which we didn't have before, and we were able to push to work hard in more than 60 countries to have access to pediatric MDR-TB formulations, with support obviously from USAID and the Japanese government. Really great stuff, because to have a kid for which you have to really crush the pills and dissolve them into water is really difficult. So having that on the ground is extremely important. But going back to your point around the research, actually, I want to touch something that it's not an easy topic, and I'll not become the friend of anyone, is the fact that I realize now with the COVID situation that money are not the issue. The bloody scare is the issue. Because we see now, as you rightly opened the discussion, there are around, I understand, between 70 and 80 vaccine candidates for COVID, and around 100 different diagnostic for COVID. For TB, we have 2-3, and we say it's a very good pipeline. Diagnostics since the CEPHID for 10 years. We are getting some things and some tractions over the last 2-3 years, but nothing close to this. So I hope that the COVID lesson is that the decision makers and people with money will finally understand that investing in health is an important piece, and leaving these pieces unfunded because we are not scared enough makes us rush, and like the situation right now, which is producing tremendous losses to all economies, and things that we didn't believe, and lives of hundreds of thousands of people will be changed because of the impact that these shutdowns will have on them. Leave aside the lives, of course, of people that will suffer of the disease, should make everyone understand that a neglected area such as health, plus neglected diseases such as TB, and I'm sorry to say so, will not give anything good. MDR-TB was created because we completely neglected TB, and we never thought to have any of this. For TB, we are still having now the BCG vaccine, which is 100 years of age. So if it is possible that in a 4 months' time to have a pipeline of 80 vaccines, just because we are faced with such a drama, which in a way is generated by our mistakes, is meaning that not money are the problem, is that people were not fucking worried enough about TB and MDR-TB to produce something to help us get rid of this disease, which unfortunately remains the biggest infectious disease killer. So sorry for the passion or for the agitation or some of the French words that I used, but it's a reality. And if we don't have a strong wake-up call with this situation in changing our funding priorities, then we are a bunch of idiots. And I'm speaking here for the entire world.
Lucica, we like your passion. It keeps the conversation interesting. So feel free to share exactly how you feel with us. I wanted to turn to some WHO recommendations. I understand that the WHO is getting ready to release a set of new recommendations about how to prevent TB. And I'm curious what you expect to see in those recommendations and what you think might be needed to implement them.
You want me to start, or? Yeah, I can start. And so in a way, you made a very good combination with me and Susan, also because somebody wrote me saying, Susan, if we are sisters, so I'm very honored. We are not sisters, but somebody thought on the call. But also because we are a combination of, I am more of the advocacy side and the pushing the boundaries, and Susan is the more, technical, correct, science and evidence-based between the two of us. But I think WHO issued the guidance Friday or over the weekend or so on, or is coming out today. And we are very happy that actually we see a huge speed in WHO pushing up guidelines and advising on the using of the new tools and so on. So this is really great. I will tell you what the problem is. So preventive treatment is extremely important. Susan is very right. The HIV community, their target of from UNHLM of 6 million people, they will do it. They took this and they are just like, we go for it. The challenge will be to put on preventive treatment the other side of the room, as I call it, the contacts, adult contacts, and the children of people with TB that are not people living with HIV. That is a challenge, and that is a challenge. And this year, especially, as I say, because we have to scale up this very big time. It's very difficult because, as I say, this will request basically testing and enrolling also and putting on treatment people that are infected. So they don't have symptoms. They will become positive and they will become sick. 10% of them sometime in their lifetime, but it's a very difficult activity. We didn't do it too much at scale, so it requests a lot of focus, goodwill, and money. TB envelopes are very small. It's coming a lot from few donors. Basically, it's the U.S. government, the biggest donor through USAID, TB, plus Global Fund, to which again the U.S. government is the biggest funder, and then the domestic resources. And the envelopes of countries for TB are very small. Now we obviously have to fight COVID and finish with this part before we fully continue our business. So that's one of the challenges that we have. The second challenge that we have is we have different ways of treating preventive therapy. Different ways of treating the TB infection, the preventive therapy. There are different combinations, different drugs. Now, the best combination that we have, the 3HP, the capacity, my hair goes up, the capacity of the manufacturers is so little that apparently there will be very little, if anything, to scale up beyond some already pre-agreed volumes that the manufacturers did. So if I am now a country Y and after this COVID or during this COVID, I decide to scale up my preventive therapy, and I'm not part of the discussions that took place, I might not have access to this new combination of drugs, which is a bit easier and shorter than the rest. So how to say is that in terms of TB infection treatment is a must. We all realize that without addressing that, we are not ending TB. The recommendations of WHO are inclusive and comprehensive, very clear about what should happen. They should be taken and implemented at the country level. But what happens at the country level in terms of money, willingness, political commitment, and then availability of tools to do that is a very different conversation that we need to have. But Susan, I'm sure she will add some very more granularity to my points.
Thanks, Lucica. It's a pleasure doing business with you back and forth. So just to go back to what Adva had asked, just to put a little bit more technical background, and hopefully not give away anything. I think the guidelines are embargoed until tomorrow. But what's coming out from WHO is the new updated guidelines. There are guidelines that are updated after just a year. That's how fast we're moving. It's amazing. And they're also paired with an operations manual for how to use the guidelines, which is actually something CDC worked with WHO on, and then with a mobile application to help healthcare workers to use the guidelines and to do contact tracing. And so the package is another example, I think, of kind of this rapid policy and practice that is going on in the TB world. And given what we've talked about in terms of TB preventive treatment or LTBI, or treatment of latent TB infection, I think in the guidelines we can expect to see kind of an increased focus on household contacts, especially adults and children. I think we're making great headway for people living with HIV. I think we're going to see more of a call to have the TB and TPT integrated with contact tracing. I mean, that's the way it should be. We need this to be one package. We need to have a continuum of care. I think there's going to be new tools that are being recommended in terms of looking at how to diagnose TB infection, which is an area that's also been neglected. I don't think we have enough data to be able to identify the people who will go on to progress to TB disease. And I also think that the recommendations will be for the shorter regimens, as Lucica said, the 3 HP, which is a 12-dose regimen over 3 months, and for 1 HP, which is actually a daily regimen of 2 drugs for a month. And I think a major part of excitement around this is that the costs have come down for these new shorter regimens. So I guess last thing I'd say is one of the important things we need to do with these guidelines and what partners can do is to kind of work together to help facilitate countries to kind of do rapid sharing of their experiential learning and collective problem solving. One of the things that we've done with PEPFAR, CDC has done, is around TPT and people living with HIV, where we have Kenya's made some rapid implementation of TPT and been very successful. And our CDC Kenya office has brought together 3 other countries, Uganda, Zambia, and Zimbabwe, who are, battling this similar epidemics of TB and HIV. And as the result of bringing these countries together to work and to share their experiences, we now have Uganda put 500,000 people on TPT in 3 months. Then we had Zambia following this with an initiative to put 100,000 people on TPT in 30 days. And Zimbabwe is now planning its own initiative. And I think the way forward is to share these lessons more broadly and beyond the people living with HIV community. And just to say that these guidelines are really underlining that this is a very affordable intervention that can prevent families and communities from getting TB and from falling into poverty, and in that way also prevent the catastrophic costs we see. And really, this is one of the major pillars that we need to break the TB curves.
I wanted to follow up on something that Lucica said. We've gotten actually quite a few questions in, so we're going to turn to some of these questions and see how many we can get through in the next bit of time. And one of those questions is really about the sort of U.S. role, and specifically USAID's role in boosting the global response to TB. And Susan, maybe this is a question for you. I imagine you work very closely with the folks at USAID, and so I'm curious what you see the role of USAID in all this work.
Oh, well, yes, we work very closely with USAID. USAID is actually the lead U.S. agency for the global TB response in the U.S. They arrange all the bilateral funding. I believe we have an envelope of about $240 million for bilateral aid right now, and USAID leads the implementation and the deployment of those funds through many global partners, and also supports the CDC.
Great. We also had a question, which I think is a question that's top of mind for a lot of people these days, which is that, even though TB kills more people than COVID-19 daily, it's certainly not gotten the same sort of level of attention or had the same impact on the global economy. And so we had a question from someone that was, why is that? Why doesn't it get the same attention? Why hasn't it had the same economic impact?
So I can give my thought. As you imagined, we thought about that because initially it's like what we have, according to the estimates and the data of WHO, around 4,000 people that die of TB every day. Huh? So I would dare to say two things. One is TB. COVID-19 is spread much quicker, is much more contagious, and it spreads extremely quickly. We speak here of one person infecting 2.5, the latest things that I've seen, others in a week. The TB, we have to be very clear, infects are up to 15 a year. Okay, so I think the transmission rate is lower in TB. But the most dramatic thing is for TB being with us for a long time, it became something that we kind of are comfortable to live with. And it also created this feeling that it cannot affect us. It's not my problem. In a lot of parts of the world, Western Europe, North America, Australia and others, TB is not seen as a problem of the people there. It's seen as a problem of others, not mine. And even if there are cases, because we always make the case for this, we always make the case that TB has no boundaries and, it's airborne and blah, blah. It's also somebody else's problem because the likelihood of getting it it's much smaller. TB is affecting most vulnerable and people that are not that much in the face of decision makers, in the face of political leaders, are those that have vulnerabilities and their visibility and access are extremely limited. So it's not my problem, my saying, some people, it's some others' problem. While with COVID, the fact that it's so quickly spread is very clear that it goes, at large numbers. And I have to say that TB lost its spectacular aspect in death. Several 100 years ago, people were dying with hemoptysia and was a very emotional feeling. Now people die with TB quietly, very much unknown because of the groups that there are, but over a time frame that is a bit longer. So I think it's a combination of, I know this disease for more than 1,000 years, a combination of the fact that it's not necessarily a disease of the most it's in the face of everyone. It affects a lot the Big South, and a combination of the fact that COVID is so contagious and it leads to unfortunately very rapid negative outcome. It's probably, in my opinion, what's happening. It's a very bad wake-up call for the entire world, what's happening right now.
Great. And Susan, feel free to jump in with your response on that as well. But we did get a couple other questions for you. One about sort of the CDC response in Latin America. Latin America and the Caribbean have seen incidents of TB increasing. And so we had a question about what the CDC is doing to help the region improve its response.
It's TB response, correct? Yeah. Okay. Well, from our point of view, from the global TB program at CDC, we have CDC offices in Latin America. We are supporting the work around TB and TB HIV. We are helping to build capacity in lab, in surveillance, in infection control. And we're also actually partnering with Mexico right now to look at kind of some new diagnostics, how to roll out expert in those in their healthcare structure, and also around treating children, looking at new diagnostics in children.
We've gotten a couple questions in about TPT. And so one was for you, Susan, around the role of the Global Network for Adolescents in ensuring access to TPT in that age group. We had another question about the duration of protection of TPT. And then a question for you, Lucica, as well, about whether there are discussions to increase the capacity of 3HP. To take that first, Susan, and then we can go to Lucica.
I'll grab the first one. So in terms of the role of the global adolescent group, I think that it's very important for us all to be working together and to be focusing on all different populations, especially children and including adolescents. So they need to be a big part of our work moving forward. And we actually, as part of our centers of excellence that I mentioned earlier that we're standing up in sub-Saharan Africa, we will be focusing and hopefully partnering with this group to look at adolescents as well. In terms of TPT and duration of protection, I think that we are still working on that and trying to figure out the final answer to that. And I think it will be partly related, the answer to that will be related to kind of where you are, where you live, and the force of infection, and the burden of TB in any specific area where you're administering TPT because of the risk of re-exposure and reinfection.
I want to take the question on sort of whether there have been discussions or advocacy efforts in terms of increasing capacity.
Yes, as you can imagine, the GDF team are really at the forefront of this discussion. There will be generic production coming in. Unfortunately, so yes, there are discussions. Unfortunately, I'm not sure how much it will help, because especially now with this situation right now, the generic products, I think, will appear in the Q4 some time. And so for 2020 will be very difficult, I'm trying to say here, at least from what we have right now, because as I said, the targets are very large. You know, we need to go to 30 million people put on TPT. Out of which 6 million are people living with HIV, and the remaining are all these 24 are contacts of people with TB and so on. So we speak here of huge numbers. As I said, the HIV community is running with this 6 million, they will probably go even above. And there was some discussion and some pre-agreed deal, to say so, that certain groups will get certain volumes. And when you add all of this together is the entire capacity of now, plus whatever will come this year from the generics, will very likely, very little 3HP will be available for distribution. We are looking into it and pushing like crazy, as you can imagine. But it's something that we need to be mindful of. Now, I want to say two things. 3HP is not the only thing that we can use. And this is a situation with 2020, plus that we have all this COVID, which brings another, disturbing factor into this equation. So we are carefully very much monitoring this, because as you can imagine, a lot of the products are coming from India, and if India is in lockdown or God knows what, for how long, there will be impact on all these things as it goes, including the other product that comes from Western Europe, which is also in lockdown, as we know, and there is. So it will be, I would say, in terms of 3HP, a bit of difficulty in navigation this year, but I hope that early 2021 or even late this year, we are able to push things up with 3HP. But again, I am infected with TB myself, and is not just the 3-HP that I can take for TB infection. And if there is no 3-HP, I have to deal with all the other, and there are many recommendations of what other drugs should be used and in what dosages and for how long. It might not be the most amazing thing, but we have to do what we can with what we have.
Great. We also had an interesting question come in about the role of pharmacies in rural communities in low and middle income countries. And in many of those communities, pharmacies are often the first point of access for medical advice and treatment for people in low and middle income countries, especially people who are poor and rural, where they may not go to a hospital or a clinic until after they might try to see if there's some sort of treatment available at a pharmacy. And so we had a question about how you are involving sort of public and private pharmacies in your programs to help in the efforts to fight TB.
So I can say very quickly some things from us, because I know basically we are working a lot in pushing public-private partnerships and including the pharmacies and including private providers in providing care for TB. So through the platform called TB Reach, we even funded some of these initiatives at the country level. And as I said, it works. You see, it's very important to understand very well the context and also like what's in it for the people in the pharmacies. You know, it's not easy to bring them in just asking to do things, but also facilitating their links with the program, their links with ensuring that it's easy for them to refer or do whatever piece of work it is. So there are some lessons learned from the TB Reach part, and as well we have another team that is looking even at how to increase adherence technology and how to engage much better the private sector in the efforts, and private pharmacies are coming very much at hand with this. And also the third way we are working with the private pharmacies is looking into some countries how much a TB product is sold by the private pharmacies. That also gives you a sense of how many people are, you have basically the, the data to justify that people are first, as you rightly say, going there and in which number, and how many of them are accessing first the private sector and maybe never the public sector. So we are working pretty well with the private pharmacies from the Stop TB side. A lot to share on there.
Do you want to add something on that front?
Yeah, I guess I would just say from the public health standpoint, you know, I think we've learned very much how much we need a people-centered approach. And so it's very important to work with the pharmacies to make sure that patients have access to care and linkage to care, and they're an important point of how we can do that. And also from a public health perspective, you know, in the work I've done in the past, especially in rural communities and among refugee populations, the pharmacists and the local healers or the local doctors are a very important part of disease surveillance networks. And also important to educate and to make part of the larger treatment programs. Over.
Well, I wanted to thank everyone for submitting their questions, and I'm sorry we couldn't get quite to all of them, but we are running short on time. I wanted to ask one last quick question to both Susan and Lucica, and that's if you had sort of one call to action for this moment in the fight against TB, what would it be?
Go ahead, Lucica.
I think, Susan, you want to go? Okay.
Go ahead.
No, go ahead, Susan.
No, it's okay. Go.
See, this is, somebody said that this is the problem when you have just ladies. We are too polite with each other. If we were two men, we were all on top of each other here. Who speaks first? I just want to say that my thought, this is a time of being together is not a time of is a time of action in togetherness, because sometimes and very often, not just in the TB community, but in many places, we try to do things so well that we lose the momentum or we lose lives or whatever. This is not a time to, unfortunately, think and try to get the perfect things, but a time of action in togetherness, because we have to get out of this COVID-19 situation together, but we have to ensure that the TB diagnosis and care continues.
Great, Lucica. I guess that, I just say that on the eve of the World TB Day and in relation to our motto of it's time, I guess I would just say the call to action to me is it's time to stay united, to persevere, to stay the course, and to make TB history.
Well, thank you. I think that's a great note to end on, and I thank both of you so much for joining us, and thank everyone in our audience. A recording will be available for everyone on this call and for folks who weren't able to maybe tune in at this time. And thanks again to USP for helping make this happen. Thank you all, and good luck in your work, and to a great World TB Day tomorrow.
Thank you so much for doing this. Thank you very, very much. And thank you, Devex and UPS, and thank you, Susan, my dear sister. Thank you.
TB.